We are now to our public safety update. And tonight, neither Police Chief Bishop or Fire Chief Steelman are here. So I was going to take this opportunity to update us on what's going on with the coronavirus, the COVID-19. So if you'll bear with me, I want to go through a few things with you all and bring our citizens up to date. As you all are aware, we had a positive diagnosis of a COVID-19 case this week and held a press conference on Tuesday where we provided information for you. But I wanted to just go back and give you some information as to where we are from then to now. We're going to try to be as transparent as we can with the citizens and realize that we will give you information that we can as we can. The patient traveled within the United States. He was seen by Christ's Good Shepherd and has been isolated at home. Tests were taken March 5th and results received on March the 9th. The risk of transition to Gray County at this time remained very low. This individual is at home, recovering, and doing well. And what I need you to understand is, because I've been flooded, and I mean flooded, with questions about this individual. And you have to understand, there are things that we cannot divulge. There are things you're asking that I do not know, and you think that I'm not being transparent. There are federal laws in place, HIPAA violations, CDC, health rules that we are not allowed to give information out about a patient. I don't know those informations because I'm not the patient's physician. So I don't know any more than you know, other than the patient traveled outside of Longview, contracted this, and came back to Longview. I don't know where they live. I don't know where they're from. I don't know who they came in contact with. But I do know this. The epidemiologists in charge do know all of this, and they're taking care of all the things to keep our city and our county safe. They've contacted the people that have come in contact with this individual. They have quarantined those that are necessary to be quarantined, or test those that need to be tested. But understand, we cannot give out information against federal laws, and that's not going to happen no matter how many times you ask me that or curse at me on Facebook. It's still not going to happen. So, because I don't know that information, I'm not privileged to that, and I shouldn't know it. So please bear with us and know that what information I do have, I will share freely, because I want you to be informed as I'm informed. For the majority of people, the immediate risk of being exposed to the virus that causes COVID-19 is thought to be low. There is not widespread circulation in most communities in the United States, according to the Center of Disease Control. That does not mean it won't become widespread, but as of now, it is not widespread. But this is still early on in the U.S. In other areas of the world, it is more widespread because it's been going on for a longer period of time. Illness due to COVID-19 infection are generally mild, especially for children and young adults, according to the World Health Organization. Hand washing cut the risk of respiratory illnesses by 16 to 21%, according to the CDC. So what that's telling you is this. It's telling you that hand washing is extremely important. You'll cut your chance of spreading or contracting the disease by 16 to 21%. This infection is generally mild, but understand this also. That varies with certain individuals. Individuals that are immunocompromised will have much more difficulty combating this disease. And we're comparing it to the flu, and I've heard people say, well, there's a lot more deaths from the flu than there are from this COVID-19, and they're absolutely correct. But that's not comparing apples to apples, because there's a lot more cases of flu than there are of COVID-19 right now. And I hope that doesn't correlate into something that will be worse in the future, where there are more deaths because there are more cases of COVID-19. But also realize this, understand this. The flu that we get and catch and treat and immunize for every year, we have safeguards for that. We have immunization, which helps us. We also have antivirals, such as Tamiflu, to help combat the symptoms and the severity and the length of time that we are in the flu virus. So that helps our immune system to combat that disease. We do not have any of those for this COVID-19, which means if you contract the disease, your own immune system is all the defense we have to take care of that. And so elderly patients, immunocompromised patients, patients undergoing cancer therapy, they will have much greater difficulty combating this disease, even though they say the symptoms are mild. They're mild in a normal, healthy, young individual, but they will not be mild in an elderly, immunocompromised patient. So do yourself a favor and all those around you a favor and try your best to not help the spread of this disease, especially the elderly and those that are not as healthy as you might be. So keep those things in mind when you're around other people. At this time, all city facilities remain open to the public, and we are continuing normal operations. The city offers many online services, so if you don't have to come to City Hall facility, please just conduct your business online or by phone. We are encouraging you to conduct your business online or by phone if you can. City officials and public safety continue to be monitoring the situation closely, but also remember this. They are bombarded. You think I'm bombarded with phone calls and questions? Our public safety individuals are being overrun, and our hospitals are being overrun by everyone that thinks they've got this virus because they sneezed or they coughed. So use some judgment before you bombard our public safety officials with things that are not relevant at this point in time. So please be cautious of that. Now, out of abundance of caution, the city has chosen to cancel several upcoming city-hosted events. And I know this is an inconvenience for some people, and I'm sorry and apologize for it. But the inconvenience is not to be overshadowed by the significance of this disease that can be spreading through our community. These cancellations will affect events expected to draw large crowds through the end of March. This decision does not impact every event hosted by other organizations. We'll be in discussion with the organization of the previously scheduled events at city parks and facilities, including Mod Cobb. So if you have an event scheduled at Mod Cobb, we will be in touch with you about what we're going to do about those facilities and the closures of those, if necessary, in the coming weeks. So you're going to have to remain flexible and understand we're going to do what we can to protect our citizens in the best way we can as a city government. We will notify the public of events that have been tentatively rescheduled once those dates have been confirmed. We'll continue to monitor the situation as it develops. And we hate to have to do this, but in the interest of public health and public safety, which I've said this a million times, the primary goal of city government is public safety. And this is a public safety crisis. So we have to approach this in a way that's prudent. And I hate to close events or cancel events, but I mean, look at other cities. I mean, the city of Houston is canceling the livestock show and rodeo. That cost the city of Houston $265 million. National Hockey League, NBA basketball, the list goes on and on. South by Southwest, NCAA tournament, men's and women's. Events are being canceled all across the country because of fear of spread of this virus. They're trying to prevent the spread as much as we can. And so we need to do things in our community that prevent the spread as well, and that's what we're trying to accomplish by these small measures that we're taking on a day-to-day basis. Some of the canceled events will be March 20th, the Grassroots at the Green, March 21st, Longview 150 Transportation Show, March 21st, Longview 150 Cannibals Baseball Reenactment, March 23rd, District 6 Town Meeting, sorry, Mr. Pirtle. March 26th, 2020 Census Pep Rally. March 28th, the 2020 Strut Your Mutt 1 Mile Wag Walk. March 28th, Chautauqua Festival. Whatever it is, why didn't y'all spell it out for me this time? Chautauqua, yeah. Okay, those are city events that we are canceling at this point in time. And as I say, through the end of March, we will continue to update this and monitor this, and hopefully we'll be able to continue business as usual in April and May, but we will be fluid and we will do the things that we need to do as a city and as a government to protect our citizens. Just a few things that you can do to help us out and to help your citizens and your families out. Stay home when you're sick, except to get medical care. Avoid touching your eyes, your nose, and your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Avoid close contact with people who are sick. Clean and disinfect frequently touched objects and surfaces. Wash your hands often with soap and water for at least 20 seconds. So these are just simple things that we can do to try to eliminate the spread of disease or contracting disease in our own homes and in our surroundings that we are in every day. So Longview, this will not be the worst thing that ever happens to us. So let's buckle up, let's band together, let's do what we know is right for our fellow citizens, and let's whip this thing, because the last thing we want to see is something in our community that spreads that we can't control. So we'll do our best, and we'll keep you informed. As I say, I will keep you informed of every event that I know of, everything that I can tell you, I will tell you, because I have no reason, and there's no reason or advantage to keeping things secret from the community. An educated community is a prepared community, and I'll do my best to educate you so we can all be prepared. So I have stuff on my Facebook that you're constantly talking to me about, and I continue to enjoy that. But understand, if I say we can't do it, we can't do it. And that's just the bottom line. So I thank you for your attention. I thank you for the support we've received. We've received hundreds and hundreds and hundreds of emails and contacts on what can I do, how can I help, tell us what we need to be doing, and those are the attitudes we need to continue throughout our community. So let's continue to be vigilant and help each other that we can help ourselves. Any questions, council?
Thank you, Andy.
Thank you all. And Chief Stillman, nice to see you here. I know you had to rush to get back, but we appreciate you and all that your team is doing, Chief. You all have, there's no end to where y'all will be stretched in the next couple of months, but we appreciate the vigilance and the dedication that you all show us every single day.
Thank you.
Thank you, sir. Thank you so much. And by the way, you all might have seen that Tyler was contacted by the NET Health Department to do their closings. We did not get in contact with NET today, and I don't know why, but it doesn't matter. We're going to do what we know is right, and the right thing to do is what we're doing. So we'll continue on that path, and I appreciate y'all's continued understanding.